For many women, this topic is layered with silence, stigma, and fear. But fear often grows in the absence of knowledge. And knowledge, real, accessible, compassionate knowledge, is the first step towards reclaiming agency over our bodies, our choices, and our well-being. Today's conversation is about breaking that silence. It's about equipping ourselves and each other with the tools to ask questions, seek answers, and advocate for our own sexual health without shame. So take a breath, settle in, and let's walk into this garden of truth together.
Hey, to all of our listeners, you do us honor, and welcome back again to In Martha's Garden podcast. I'm Tiffani Mintz,
And I'm Nova Caprice.
and we are super excited to be back sharing this space and time with everyone tuning in. If you're here with us for the very first time, we would like to take this moment to say welcome and thank you, not once, not twice, but 3 times for taking time out of your schedule, busy or not, to join our IMG community. And you do us honor. How are you feeling, Nova Caprice?
Tiff, I am feeling a little battered and bruised emotionally, but I'm back on my feet. I'm excited for this next episode. How are you feeling today?
I am feeling grateful and excited as well. And yes, it was emotional, but we got through it all together as a family and we got to love on you. And so, yeah, I'm ready to go.
All right. Well, before we get started, I just want to take a moment and recap what we did last week. It was the first time that I talked about my brother, and so it was very emotional to come to a tragic climax the next morning when they found him. And so we both kind of talked about how it impacted us and what we went through.
Yeah, so I just wanted to be there to support you all. And I love doing it. And I also learned some things, not just about suicide, but about you all and your experience. And because I have never experienced suicide in my family. I'm talking about my immediate family. You all are family, but I'm saying my immediate family. And so, yeah, for me, it was very emotional because I felt you all, right? So I felt your hurt and your pain. At the end, I felt like you all had some release
Yes,
and that it was a good thing, right? To talk about it.
it was. It's time. I'm not in the same place and space that I was back in 2014. I have my tools to be able to deal better with the reality whenever I get the reminder that my brother is no longer here. They come in waves now instead of me feeling like I'm drowning. So I know how to handle better. And it was good for us to share because there might be other people going through the same thing that we did. We were completely caught off guard. Being one of the last people to talk to him, I carried around the sense of failure that I could not bring him back from his decision. And so it was very emotional. I was happy finally to do that episode.
Shout out to the IMG community because I did get some text and people calling saying they are putting their arms around you and Cassandra. They're hugging y'all because the episode was so emotional and so powerful. About 5 people sent text to me. It was good to see that you all came through that place, or you have gotten through that space where it was so dark for you all.
Yes, we did. Like I said, it was a long time coming. And it's not just me and her. We have other siblings. We just didn't talk about it. So this is a new beginning for not just me and her, but the rest of our siblings. And I'm happy that I was able to share it with our listeners finally. And while we are still on the subject, September is Suicide Awareness and Prevention Month. And in all of the states and in your neighborhoods, they are conducting the Out of the Darkness Walk. And that is a walk that raises money for and the proceeds go towards education and prevention of suicide. And it's for the people that still need to get help and services. This is very important, this walk, and it's in, like I said, every state, every community between September and the end of October. So there's people that have plenty of opportunity to join if they would like to. And that is a sea of people who have been through either what you've been through or what your loved one has been through. All right, ladies and gentlemen, it is story time. So without further ado, let's get into it.
Let's do it. When was the last time you had a conversation about sexual health that didn't feel awkward or rushed? Yep, same here. Today we're having a conversation about a topic that's often whispered about, but rarely explored with the depth and honesty it deserves. Women's sexual health. It's more than biology. It's about empowerment, education, and breaking down barriers. Sexual health is a vital part of overall well-being, yet it's often overlooked or misunderstood, especially as it relates to Black and brown women. Joining us today is a lady who's not only passionate about this subject, but also deeply knowledgeable. She's here to help us unpack the myths, share the truths, and open up a dialogue that every woman, and frankly every person, needs to hear. This episode is extra special for me because our guest isn't just a leading voice in the field of women's sexual health, here to shed light on the science, the stigma, and the solutions. She is someone I know personally, someone I admire, and someone who's been a mentor to me in more ways than one. She's smart, funny, and unapologetically real. Whether you're a healthcare provider, educator, or simply curious, this conversation is one you won't want to miss. So let's talk about it. Nova Caprice, please let our listeners know about the rock star joining us on this episode of IMG.
Absolutely. Kalenthia L. Nunnally is a powerhouse in public health with over 30 years focused on HIV prevention and sexual health education for Black women. She founded the Teen Pregnancy Prevention Center and now serves as program director at Blessing Hands Outreach Inc., leading HIV and PrEP awareness efforts. She's the state lead for women and faith activities and consults through Creations by Cat, building partnerships and driving initiatives. Kalenthia chairs Miami-Dade's Black HIV Coalition and Sisters Organizing to Survive, and serves as a community captain for Vive Healthcare's Risk to Reasons initiative. Her work is all about empowering Black women to take charge of their sexual health through education, advocacy, and community mobilization.
Welcome in, Kat. Thank you for coming on.
Thank you for having me.
And Kat, welcome. Thank you so much for being here. I guess the first thing that we want to know is, can you start by sharing what brought you into this work and why sexual health for Black women matters so deeply to you?
Well, I was a teen parent. I had a daughter at the age of 16. Her name is Carol. And she was and still is my reason for so many things that I do. I was afforded the opportunity to finish high school and go to college. And when I came back home, I realized that the girls who were pregnant with me, daughters, were having babies. So I started meeting with the girls at the park, just a blanket and some conversation and cookies and jungle juice at the time to talk about what made them want to have sex so early. after many conversations, I found that early sexual activity came from different things within the household, television at the time, and just curiosity. So I founded the Teen Pregnancy Prevention Center with hopes of preventing pregnancy among teens or young women of childbearing age. No, not of childbearing age. It was just teens. So we started doing non-traditional things, like we didn't follow a curriculum or anything. We just talked about topics that were prevalent at the time. We talked to the girls about how they felt, what made them want to engage in sex, and the program took off. I started the program October 4th, 1993, and I ended up dissolving, I think it was March 2010. My mom got sick. We had some funding issues, and I dissolved, but did not stop the work. So that's what started.
Would you say that's what inspired you to work in PrEP outreach, especially with women?
I think what inspired me to work with PrEP was I was doing the pregnancy prevention, and I'll never forget, I got a 11-year-old girl, Hispanic girl, who was pregnant and who had HIV. And I wasn't into HIV at the time. And then I had a case manager. His name was Brian Brown. And he would tell me doing outreach. And outreach was us going out into the community, talking to women, getting them tested, providing services for them. He would tell me all the time, like, you're so good. You're so good. Like, you're just so real. And they relate to you. And I was like, that's what it's supposed to be. Like, we're talking to these women about babies and sex. So after going through that experience with this young girl who was pregnant from her mom's boyfriend, I got into HIV. And during the time in the 90s, Black people were impacted at an alarming rate.
Mm-hmm.
So when we started doing testing and I found out, so many Black people were infected with HIV, it was like jaw-dropping. So I wanted to educate, empower, get people tested, do what I could to be the difference I wanted to see in my community. And that's how I got into HIV. Well, years later, medical technology changed, of course. How we implement prevention changed, and PrEP came along. So PrEP originally wasn't for Black women. It was for gay white men. And once we realized that it was for us, I wanted to be on board and educate women about PrEP. So that's how I started doing PrEP outreach.
I just want to say, Kat, you took something that could have set you back or put you on another course, and you turned it into a positive. As a teenage parent myself, because I had a baby at the age of 17, I just want to say how proud I am to know that you're a success story.
But I had a village. Her paternal grandparents were heavily involved.
Mm-hmm.
Her dad went away to the military, but his parents were heavily involved. My grandmother and my parents were involved.
Yeah.
They ensured that I got the things I need, but they didn't keep that baby. I had to keep that baby. I didn't want any more. I waited 9 years to have another one.
Sound like we came from the same generation of keep your baby.
Yeah, I didn't want any more. But yeah, that had a lot to do with me wanting to do this. My first job out of high school was working at the public defender's office. I did an internship and got a job. And I can remember as clear as today, learning, being in the jail, working with the judges, and like loving that stuff. And I worked with this attorney, and he used to say, girl, get my coffee. And I had a whole problem with that. And I said, this is not working for me. So I told my supervisor, her name was Lalitris McMurray, like, I'm going to resign from my job and start my own business. She was like, Kalenthia, go to your desk. I said, okay. And I did it.
Wow.
And to this day, she supports me. And she was one of the first professional women that I longed to be like. Like, she was the best. Like, she was just the best. I just thought she was the best. I had my hair cut like hers. Her mom had a beauty shop. I wanted her hair color. I wanted my hair cut like hers. I just admire her that much. And, to still be in contact with her today is an awesome feeling for me as well. And for her to have seen what I did is a good feeling.
That's awesome. Thank you for sharing that with us at Get My Coffee. I wish.
Kat, how do you explain PrEP in a way that feels accessible and relatable for women in the community?
So when you think about your sexual health and you think about what does that look like? The word sexual health looks different for different communities, different groups of women, based on education, based on access to health. So there are a lot of social determinants around that one term. What does it look like? I would best describe it as PrEP is a way for you to take care of yourself sexually so that you are not infected with HIV or so that you don't become infected with HIV. It does not protect you from other STIs and STDs or pregnancy, but it will prevent you from getting HIV. And when you think about information and how it's disseminated throughout communities, HIV is like the big thing. So no one wants to get HIV. So we use that to inform and educate women. But once you get the opportunity to sit down with a woman and talk to her, you can go into further details about how PrEP can impact their lives in a way that's positive more so than negative. A lot of people get confused because Truvada for PrEP is also used for persons living with HIV. The question becomes, how can this prevent me from getting HIV if people who have HIV are using it? So that's how it best described.
Gotcha.
What are the biggest barriers women face when it comes to learning about or accessing PrEP?
Social determinants, access to care, insurance bureaucracy, all of those things. All of those things. Today, there are so many systems set up where you can get PrEP. We have PrEP Locator. Wherever you live, you can put in your zip code. It'll tell you where you can go and access PrEP. Insurance. Now, some clinics offer it for free. There's a sliding scale with insurance because there are labs that are associated with the usage of PrEP. Every 3 months, you have to get your blood work done. It's not just like you pop a pill and that's it. There are also different types of PrEP now. So we have an injectable that you can use, but just getting women to become familiar with the word PrEP before getting into the injectables and the patches and all these other forms of PrEP that are coming out. Like the lack of education among Black women. When you talk to Black women about PrEP and they think you're talking about prepping their meals for the week, prepping their clothes, like they have no clue. I remember being in Atlanta and meeting this gentleman. I call him Mr. Macaroni and Cheese. We were at a restaurant. And this gentleman said, "Oh, I've been on PrEP for 9 years." Well, this is when I was just learning about PrEP. He said, "Oh, my white gay friend introduced me to it, told me about it, and I started using PrEP." Well, my partner, Alicia McKinley Beach, who is a renowned international guru around PrEP in Black America, she has a public health university where she educates about PrEP, and day to day she's well sought out. She speaks all over the world. She speaks for different platforms, from universities to pharmaceutical companies to private companies. Well informed about it. She also educates us. So the goal was to get women to just talk about their sexual health, just to get women to talk about sex. Like it's one of the most natural things in the world, but we don't talk about it.
Right.
Back in 2008, Alicia McKinley Beach, along with Ronald Henderson, who's no longer with us, and some other staff, came up with an initiative for Black women called SOS, Sisters Organizing to Survive, where we talk about HIV and sex where we live, work, play, and worship. This became a huge project throughout the state of Florida we would have competitions on who's informing the most women, methods and how we're using to inform the women. What are we doing? How is this impacting this community? And that's when we started to see the decline in HIV. But it really wasn't a decline. We did an article called Silence is Death. This was done with the health department and community partners. And it spoke to the impact of HIV among Black women, Black men, gay men, men who have sex with men. There are so many terms, like I can confuse you with the terms. Some people, or we all, look at Black men and say, oh, he's gay. Not all Black men are gay. Some Black men are MSMs. They just have sex with other men occasionally. Some are bisexual. Some don't consider themselves bisexual. So there are so many terms and different things. All of it goes together. And like I say, it can become convoluted if you get into the terms and who's using what. Bottom line is, persons who are sexually active need to protect themselves. And just like PrEP was marketed in early years for gay white men, it is not just for gay white men, it's for everyone. PrEP is for Black women. So that's what we hold and what we speak about most in community now, how PrEP is for us. We didn't know it was for us, but it is for us. And, Black women receive the least amount of attention, and I feel comfortable saying attention because there are so many other categories and so many other groups. A lot of the focus is on MSMs and gay Black men, not Black women. So we do what we can to bring the attention to Black women. There are several initiatives happening now to educate and inform Black women, but the ones that work are the ones that you stick to, where you see the impact, where you see the difference in gaps. So SOS is one of those initiatives. Really quick, I'm going to tell you about another initiative that was called SISTA, Sisters Informing Sisters About Topics on AIDS. I watched, I facilitated, I was a trainer. I watched this intervention change lives of Black women. It was so impactful because it wasn't just an intervention. It was a healing session. We talked about ethnic and gender pride. We talked about sexual health. We talked about how do you take care of yourself. We talked about how do you cope. All of those things matter. You just can't walk up to a Black woman and say, let me talk to you about your sexual health. You know about PrEP? Have you been tested? Are you having sex? Life happens for us, and it continues to happen. If I'm in a situation where I don't know how I'm going to pay my rent or my lights, and you coming up to me talking to me about PrEP, sex, or anything else, you just might, get your little feelings hurt.
How did you get around that subject? What did you do?
What we do is when we do outreach, or when I do outreach, I try to have a system in place. And when I say system, I mean someone who can do rental assistance, someone who can help with lights, someone who can help with daycare, or information how we can help them get to that help. Because if that's an issue that's pressing you and I want to talk to you about taking an HIV test or about PrEP, you're not going to hear me. If I address what's concerning you first,
Yes.
you'll hear everything I have to say once I make you feel secure that I'm going to help you with your issue. And so that's how we managed to get women involved.
That's awesome, Kat.
Yeah.
Man, that's awesome.
That is awesome.
It's like you're taking stressors away from them so that they can focus on the really important thing, and that's their sexual health.
It's funny that you say stressors, because when I approach women, that's what I say to them. What's your 3 biggest stressors? And normally I get my man, my children, and bills. Well, I can't help you with your man. All I can tell you is I come first. Your children, you can manage your children. And your bills, how can we help you get in a position where you can take care of your bills? And that just relaxes the woman, and then they begin to talk. And Black women are different anyway. You can't just approach us and talk to us like about certain things as if I would a Caucasian woman. They don't think like we think because our lives are totally different. So it affects us differently. When you look at in Florida, Black women make up 32% of the population, but make up 54% of new HIV infections. And to this day, we're still dealing with new infections. So until we do something different, we're going to continue to deal with the same thing. I've been saying for years, go back to basics. Just talk about it. Talk about it in the church, in the laundromat, in the corner store, wherever. Talk about it. We have to talk about it. I always say that sex is one of the most natural things in the world, yet we never talk about it. We'll go into a new relationship feeling like we have to have sex, but we never talk about it.
Yes. And Kat, for me growing up, those were things that I was taught to keep close to my chest, about not my sexual health, but just sex in general. Right. And so when you start to hide or not hide, but keep things to yourself, that includes sexual health.
Mm-hmm.
It's kind of hard for a person to talk about things that, sometimes their own parents didn't talk to them about.
Yeah, that's true.
And
it was taboo.
Mhm.
My grandmother, whom oh my God, everybody who knows me know that she was my entire world. She would tell me, if you have sex with a boy, I'm going to know. If you kiss him, I'm going to know. And I used to be like, okay. And when I got pregnant, I remember wanting to hide. And she told me, I know already, you don't have to hide. Just be aware of what's coming. She didn't say be aware, but she said, you better know what's coming next.
Yeah.
And all of those things stick with me. Like even today, I remember being at Teen Pregnancy Center and going to a school. It was Charles R. Drew talking to these kids. And this little girl told me, don't worry about worry about yours. And I was like, whoa, a little girl. I then started thinking, we think these kids don't know about sex and about things. They may not know the proper way, but they know. And if we don't educate them properly, they're going to get it from their friends who might be getting it from their auntie, uncle, who may be molesting them, or the neighbor across the street who may be doing something, unethical. So they get information even today, younger.
Exactly.
Younger.
Yes.
These kids know.
My granddaughter is 12, and we just had the conversation. I don't want her to fall into the same trap that not only her mother fell into and father fell into, but I fell into. My first month out having sex, I was pregnant, and I just want to make sure that she is more aware than what I was. So.
And speaking of education, and Kat just unpacked all this stuff with education and also resources. But Kat, how does education help women feel more confident about taking control of their sexual health?
Well, when you're educated, you're empowered. You feel like you're in control of, or you have knowledge of. You may handle a situation or deal with a thing differently than you would if you didn't know about it.
Correct.
Sometimes girlfriends talk to each other. I'm currently serving as community captain for ViV Healthcare. They have this intervention called, and I'm calling it an intervention because I don't even think they know how powerful it is. It's called Risk to Reasons. We're reframing how we talk, words we use, how we address situations. So normally when you hear risk, you think of something negative or something bad, correct?
Right.
So we're changing the word risk to reasons for prevention. What are your reasons for prevention? My reasons for prevention is because if I'm sexually involved or sexually active with a person, I'm empowered if I have information or education to do what it is that's going to make me better.
So let's talk about HIV/AIDS specifically. What do Black women need to know, and what are some of the biggest misconceptions you have encountered?
some of the biggest misconceptions, first of all, HIV is the virus, AIDS is the disease. I say this at least at a minimum 25, 30 times a week. Misinformation, miseducation will have us in a dark space. So we have to as well take accountability to learn and want to know. I think anyone who's sexually active should know some basic things. And if you're not, please don't have sex. Stop. Just stop. I mean, for some people that's difficult, but I'm just saying you have to be educated about some things at a minimum. Misconceptions is that you'll die from AIDS. Some people never get AIDS. Some people get HIV. Another misconception, a huge one, is that they say you undetectable, but once you have AIDS, you always have AIDS. The use and terminology of HIV and AIDS is confusing for some. Undetectable clearly means that there's not enough virus in your body to be transmitted to another person. To find out if you have HIV, you have to take a test. A doctor clinically tells you if you have AIDS, and clinically it's if your T-cell count is below 200. Today, with medical technology and all of the different resources that are available, we rarely see that anymore. There's an initiative called U equals U, undetectable equals untransmittable, meaning that if you can't detect the virus in your body, you can't transmit the virus to someone else. So with medication, I don't want to go into calling names of medication because I ain't trying to prompt nobody. But there are different medications that people take. Years ago, people were taking 13 to 20 pills 3-4 times a day. Today, you can take a pill once a day. There are injectables that you can take, different medications that you can take that will minimize the amount of virus that's being reproduced in your body. So the cells can't be copied. And if it's undetectable, that means there's not enough cells in your body to be copied or duplicated to create more virus.
But you still are positive, though, right? Are you still classified as positive?
Once you're HIV positive, you're HIV positive. That doesn't go away. That doesn't change. If a person is diagnosed with AIDS, they have AIDS. But medical technology has changed so that there's not a lot of virus in your body to be transmitted to someone else. There are people who've been undetectable for 10, 15 years. Long ago, once you got a diagnosis, you thought you were going to die. It's so not like that today. So not like that. There are so many women. Like, I work with a partner who is positive because when we're approaching women, I can speak from the scientific standpoint. I can't speak from the standpoint of a woman living with HIV or AIDS because I'm not infected with it. So
Right.
there may be some things that they want to address that I can't answer because it's not me. A lot of times you get negative feedback as well because women like, how could you tell me something? You don't live with this every day. You don't know what this is like. And I don't. But my job and what I love doing, my ministry, is empowering and educating. But there are so many misconceptions. Today, a lot of people don't do outreach. We do outreach because Miami-Dade County is diverse. Florida is diverse. You may have one community where the incidences are high. You may have one community where, like in Miami-Dade County, it was 1 in 48. 1 in 48 Blacks were infected with HIV. And that number changed to 1 in 36. We're also the mecca of travel. So if someone comes here and get tested but don't live here, that number counts here. You kind of following what I'm saying?
Say it again.
Because so many people travel here. If I come to Florida and I'm hanging out, say I meet someone on social media, which is another issue. People meet people on social media to link up, don't test, don't know anything, don't check themselves. But I link up and I'm here. If I test here, that test counts for here. And I may live in Connecticut.
Mm-hmm.
Gotcha.
Somewhere else. But Dade County, Broward County, Palm Beach counties are sister counties, and we always have the highest numbers. Broward County is where a lot of LGBTQ persons live. They have a lot of LGBTQ plus communities. So their numbers are high, but Dade County is just as high as Broward. I think Broward was number 1. We were number 2 for the state. And it's not like we're not doing the work to educate and empower. There are still people who don't know their HIV status. And you can find a testing van on almost any corner. We do non-traditional things. We test at night. We go to nightclubs. We go to parties. We go to family reunions. Like, we do non-traditional things to educate and empower folk about their HIV status and encourage them to get tested. Some of the strategies prove to be working, but there's still so many people who don't know their status.
And Kat, when you pull up and you do the non-traditional, ways of outreach, how quick do they get the results back from things like that? Is it a rapid test?
Oh, you get your results back in minutes. Yeah. And we do linkages to services in minutes. Like, if I know a laundromat gives away free detergent on Wednesday, I'm going to be testing at that laundromat on Wednesday to, offer an incentive, sometimes $5. Sometimes we partner with the businesses to have them offer up something to get the people tested. But you get your results back in minutes. And if you receive a positive test, we then do an OraSure. An OraSure is a mouth swab, send it to the lab, for confirmation. And then we work with the person, but we never lose contact with that person from the time of the test. It's so easy. It's almost like a person who's using substances. If I encounter you and you say, I want to go get help, I need to have a resource in place right then, because I can't tell a person who needs help to call me on Monday at 10 o'clock.
Exactly.
I'm going to lose that person.
Mm-hmm.
Yeah.
Wow, Kat. Wow.
Yeah. A lot of information, a lot of great information.
Yes.
What strategies do you use to help women overcome the stigma or fear around HIV prevention?
I use this term. I don't know. I always tell women they're beautiful. That one word does so much for a person. Sometimes we don't know how much it does for a person, but I just talk. I give it to them 100. I'm very popular in the community in which I serve and other communities, but I'm known for being direct and to the point. I remember my very first, I'll say, conversation with Miss Betty, my mom. She said, you better not be letting nobody drive their car in your garage. I don't care what nobody say. You better not put nail car in your garage, and not no raggedy car. Well, me, what if they got a Mercedes? She was like, what? I was like, what is car in the garage? So for me, I knew what she was talking about, but I was like, that don't work. My first time having sex, I got pregnant. Wasn't planned or nothing. I just did something. Still having my period every month. I was playing basketball at American High. My coach was Patrice Rush. Miss Rush said, you pregnant? I was like, I ain't pregnant. You can call my mama, because we just came from the hospital and my period just went off. She said, no, ma'am, you pregnant. I was 6 months pregnant. Had sex one time and got pregnant. So my strategy is be straightforward. I don't say, well, no, I tell them what it is. If you out here having sex with no protection, HIV not the only thing you got to worry about, number one. And if you're not a person that goes to the doctor and take care of yourself, or even know how to, I'm finding that out as well. A lot of women don't know how to. I tell them, clean yourself. Do you know what you feel like? Do you know what you look like? Do you know how to touch your body and know what body part you're touching? No. Grown women, I suggest you do that. Dr. Gina Wingood taught us to always be specific when you're talking to a woman about her body. And that's just what I stick to. It's simple. It's no rocket science, something that I create just based on the woman and the conversation. I talk to them and I tell them what it is. One of the sessions for Risk the Reason is in her shoes. And with that session, the women get the opportunity to write a love letter to themselves. That is so powerful when you tell a woman to sit down, look at yourself, and write a love letter to yourself. Some of the things that come from that session are breathtaking for me. I get so many pointers because we as women never take time to see us. And I'm not talking about going out to a concert or hanging out with your lady friends and you got on a new outfit. I'm talking about seeing you for who you really are. A lot of us are broken. A lot of us have had some sexual trauma that we haven't even addressed. And a part of that session is you use 3 cards. One has a zipper mouth, one has a heart, and one has a bomb. So we create situations, we talk about situations, or we let the women talk about a situation they have, and you respond to that woman, telling her how you would respond with a bomb, with love, or with a closed mouth. That's support. Support is the most important thing that women can give to women because you just never know what a person is going through. You just never know what just happened to them, because we wear masks. We wear 1,000 masks every day.
I can ask you 1,000 questions about the misconceptions and telling people the real. So thank you for giving us just a
nobody's in
taste.
heaven. He talks about this all the time, Kat.
Yeah, the virus is just like if you get a cold, it's a virus, versus AIDS, the disease. Some people never get AIDS. Today, the likelihood of someone newly diagnosed getting AIDS is slim to none unless they've been HIV positive for years and years, never got tested, and are tested with AIDS, test out with AIDS. But, people ask me all the time, is there a cure? If you all remember, the president said we would end HIV by 2030. I don't think we're going to end it by the year 2030, but we're really, really close. We're really close.
And thank you for the explanation and the difference between HIV/AIDS, because so many people do not understand. They think it's the same thing. And I've tried to explain it to them, and you just broke it down. So thank you.
You're welcome.
Kat, how do community groups, peers, or trusted voices help strengthen your outreach?
By sharing and partnerships. Partnerships and collaborations are the most effective things that we can do in a community to end the virus, because if you're partnering with businesses, if you're partnering with schools, you're getting the information out in many ways. We have this project called the Business Response to AIDS, where we put condoms in the stores. Well, it worked for a while, but unfortunately, the people start selling the condoms. And so members of the community is like, oh, no, I can get this free. Why even go in there? But the whole goal is to put up signage around prevention, have condoms available, have testers available. But if you had the opportunity to hang out with us one evening and see, like, the food trucks will come and get in a lot. Block parties. We don't just have block parties. We do testing. We have services within the block parties. It's non-traditional. We do whatever we have to do to get the attention of people so that they hear and understand. Like right now, there's a strand of gonorrhea that they don't have a cure for. But so many people are testing positive for it, which means people are probably having sex in circles because, it has to originate somewhere and it's spread somewhere.
And you write about that, having sex in circles. And
oh, yeah.
And it seems like it's in the younger generation.
Yeah.
It's cool.
Yeah.
And that's something that piece right there, that mentality needs to be broken some way too.
And when educating, I always share that oral sex is the lowest risk. We don't like saying risk, but oral sex is, you have a low chance of getting something because your mouth and bacteria kills versus inside your body. And women are receptors. Everything is inside. Once something is inside of you, it's inside of you, and I tell women too, oh, Miss Cat, I have an infection when I went to the doctor and it just wasn't right. Well, if you don't get yourself checked regularly, if something forms inside of you and it's now on the outside, that means you've had it for a very, very long time and that it's turned to something else. But a lot of women don't know that. If we want to help somebody or we want to see something different, we got to do something different. And being judgmental is not it.
Exactly.
Yeah. Being judgmental is not it. And I always approach things as it could have been me.
Yes.
And it could have been me. It still
Yeah.
can be me. Like drugs. I don't want to try the drug that had her running down the street, taking off her clothes with her wig. Why would I want to try that? But that's the mentality of some people. I want to see what that was because she was feeling good. No, it's the same thing with sex. They say that we had this thing called bug chasers where women with new men would be infected and would want to have sex with that man just to prove a point to another woman. That's where the empowerment come in, where you loving yourself comes in, where you seeing yourself differently comes in. There are a group of women here who do speaking engagements. There are women who've been living with HIV. I had a campaign called I'm a Survivor. And together the women in that campaign had over 100 years of living with HIV. And their stories from then to now, you would think that they're totally different people, but they're not. They're just empowered. They're educated and empowered. They know who they are. They know whose they are. And they understand that HIV is just something that they have. It doesn't have them.
I love that. Something they have, it doesn't have them.
You've been doing this work now for over 30 years, and you've been working, I guess, alongside and with PrEP. What changes do you hope to see in the next few years to make PrEP more accessible and empowering for women?
Well, I started doing this work at the age of 24. And today, what I would like to see is just like you go to the doctor and they take your blood pressure and your temperature, I want PrEP to be on the menu the same way. The same way, because sex is not going to stop. Women and men are not going to stop having sex. So the empowering portion is being able to say, hey, I want this. Even your doctors, doctors don't encourage you. When some of the women go to their doctor and say, hey, I want to get on PrEP, they say, you don't need it. It's not for you. My doctor told me that. That's what he told me. What do you want that for, Miss Nunnally? I said, because what? And I also learned that doctors don't have to do anything outside of requirements for their medical recertification or specialization. So learning about PrEP or offering PrEP is something they would have to opt into. But again, you have all of these pharmaceutical companies who are saying, okay, we make this form of PrEP. We make this form of PrEP. We make this form of PrEP. Pour some dollars into community. Pour some dollars into educating and empowering the communities, especially communities of Black and brown color, Hispanic communities of this will prevent you from being in this situation. But like anything else, if all the crime stopped, if people didn't fight one another, think about the judicial system, police officers, correction officers, hospitals, judges, jails. If there was no crime, those systems would shut down. So we have to think about how systems are stopped. I would like to see PrEP on the menu, just like let me take your blood pressure. In machines, in vending machines. Like we have to be creative. If you have a group that does not attend the doctor, that does not check on themselves, their sexual health is not a priority. Let's just say that. How do we get services and information to them? We make it accessible. Grocery stores, laundromats, whatever we can do. Whatever we can do, that's why partnerships and collaborations are so important.
Meet them where they are.
Right. You may not have women that come into your clinic openly because of stigma. They don't want to be labeled.
Mm-hmm.
They don't want to be told, oh, she went over to the such and such, over to the Nova clinic. Okay, guess what? If we put options everywhere, nobody will know what you're doing and people will feel more comfortable. I just believe that.
Mhm.
I believe that too.
I'm interested, Kat, to know what you think about the DEI thing, and also how has it affected your business as it relates to PrEP and HIV/AIDS?
Funding has been cut. Programs have been cut. Whereas we can traditionally know that we're going to be able to provide X amount of services to X amount of people and we'll get X amount of funding. Everything is up in the air now. Nobody has the security of knowing what's going to happen next or when something is going to change. And the bottom line is that communities are not in positions to take care of themselves as it relates to social services. And it's not just health and HIV, it's everything. It's all social services. Fulton County, Georgia, closed their HIV department and had to go right back and open it up. In the state of Florida, there were some agencies funded to do HIP, is high impact prevention. They ended the funding on June 30th and put out a request for a proposal to do the same services because we had to change descriptions. We're not able to say Black community. We have to say marginalized communities. You can't say gay, lesbian, and transgender. You have to find different terms. So they shut everything down to start over. But what has happened is the monies are not in place now.
Exactly. And that starts all the way at the top of the chain with the researchers.
Right. And even with researchers, I feel like when you're getting dollars to do research, put dollars in your grants and in your budgets for community, because you come to our community, you get our information, you do your research, you get whatever comes on the other end of that. But we're still stuck out here with the issues you came to talk to us about. That's not help. Like, we have to find a way to level things off so that, yeah, we're giving you the information, but help us solve the information. Maybe that can be your next phase of research. Here, people are very particular about if they come to me or say something to me, because I just tell the truth. Like, we need you like you need us.
Yes.
We need you to help us. We need you to come back and say, okay, I spoke to you about ABCD, but here's some resources or here's some resolve. Like, it's like we're always doing things and never get resolved.
Well, this is the first time that I've heard the end of the circle. You know what I mean? I see the beginning at the research, but to hear someone that's actually impacted, that's valuable feedback that could go back to those researchers. So I'm glad that you said that. And I hope of our listeners that someone hears that, because that is very important, Kat. And it's huge.
It is, because she's on the ground. You understand what I'm saying? She's in the communities. And so
Yes.
you're coming in, taking this stuff, and these people are working hard every day with these communities and these people. And so give back.
Yeah, they come in, they give $25 vouchers, $20 vouchers, and they do nothing. At the University of Miami, Dr. Isadel, I've worked a Shine project with her. She comes back. She gives back. She tries to help in ways that I haven't seen other researchers do. And I've mentioned it to her, but she's one person. We have to think about that, though. We have to share that information. Like, help us out.
Yes.
Help us out.
Well, I'm excited to go back to my group of 61 scholars and say, who is doing research in relation to HIV? I'm very interested. And I want to tell them, hey, go back into the communities that you're taking from.
And if you notice today, people are more open with sharing their HIV status and how things are and what they're receiving and what services they're not receiving, which is a good thing, because some time ago, nobody would talk about it. And it makes it easier for a person who may be ready to get some help or who may be ready to share to open up. But it's because things are changing. And as it relates to services, it's going to get worse before it gets better. People often say Magic Johnson has special medicine. And I say to them, no, he has the best healthcare. And when you're in a position as he's in, you're able to get the best health care. And that I dream of a day when we'll have one of the best healthcare systems in America where people can get the help they need for free. And anyone listening, if you are sexually active, please take an HIV test. They have home kits that they can send to you in a couple states where you can do it in the privacy of your own home. You can do it at your doctor's office. And one other myth or misconception I want to clear up. When you go to your doctor's office for a panel, unless you ask to be tested for HIV or STIs, you're not being tested for it. Guys have a tendency to say, my girl just had a baby, I'm good. Does not mean you're good. That means she's good. We have to buckle down as it relates to some things we can take accountability for. And your sexual health is something you can take accountability for. You can take the test. You can know your status. You can know if you're good. I forgot that, and that was important. I'm sorry.
I want every drop that you are willing to give us. So I appreciate it. I appreciate it more than you know. And like I said, this is something that's very important to me. And I'm already thinking of ways that I can apply what you said in my own community. Just looking to see what our stats are, to see what they're doing in regards to outreach and awareness in our community for our youth and for our women of color. So thank you.
And we want Kat to come on, right?
Yes, we definitely need to have you back, Kat. This is not the end. This is just the beginning of us opening up the topic of conversation.
Indeed. This has been outstanding, Kat. I want to thank you for your time because I know you're a busy lady. So thank you for taking time out to come to our IMG community and speak with our listeners and us. I really appreciate you, and I know Nova does as well.
Yes.
And so this has been outstanding, very informative. So thank you.
You're welcome. And I can be reached at blessings with an STGK at gmail.com or creations, that's KREAZIONS BYKATT at gmail. If anyone has any questions, if they want some information about Risk to Reasons, if they want me to make an appearance, if they want me to do a talk, I'm also open for sessions. Let me know.
I want to offer a few questions for reflection. What did I learn today that I wish I'd known sooner? And then who needs to hear this conversation and how can I share it with care? And so that's what I want you to think about as you reflect on this very, very important conversation that we just had.
Well, all right. Mama used to say, give me my flowers while I'm alive. And we did that for her. And here we are once again at this very special part of the episode where we give out flowers to those who have loved on us, inspired us, empowered others, shown courage, or accomplished something truly remarkable. On this episode of IMG, our flowers will be going to Miss Kalenthia L. Nunnally. Thank you for showing up today and telling it your way, with wisdom, passion, and a deep commitment to truth. It's not easy talking about sexual health, especially in a world that often tells women to stay quiet about their bodies, their needs, and their experiences. But Kalenthia reminds us that silence doesn't serve us. Knowledge and empowerment does, and care does, and community does. Thank you for your boldness, Kat, your courage, for opening doors for others to speak freely, ask questions, and feel seen in spaces where silence used to live. For walking in places with wisdom, warmth, and a willingness to go where others might shy away from. We thank you for planting seeds and shining your light in so many lives, including mine.
Don't forget to follow us on social media and catch our latest episodes wherever you get your podcasts. For more content, visit our website at inmarthasgarden.com. That's INN marthasgarden.com. And a huge thank you to all of our listeners for tuning in.
Mama would be like, tell those people bye. You got to take time for yourself sometimes. Don't you got to get rest?